Hey, good morning. I'm Vic Senese, and today on UroNurse News, what sounds like a punchline is actually a real medical mystery affecting thousands of people around the world. It's a condition that makes something most of us take for granted impossible. They can't burp. Not once, not ever. And for those living with it, the result is not just discomfort, it can be life-altering pain. It begins simply enough after meals. A pocket of air becomes trapped in the upper digestive tract, moving up and down the esophagus like a stalled elevator. Rising, falling, but never escaping. Eventually the air gives up and moves deeper into the gut. The result? Severe bloating, chest pressure, abdominal distension, sometimes nausea so intense it mimics more serious conditions. Some patients even end up in the emergency room, convinced that they have appendicitis or something far worse. That's exactly what happened to one woman who spent years quietly suffering, assuming she just had a sensitive stomach. Over time, her symptoms escalated, bloating after meals, painful pressure, and a body that often looked visibly distended by the end of the day. She learned to cope, smaller meals, avoiding carbonation, and adjusting daily life around digestion. But nothing truly solved the problem. Then came a turning point. A late-night online research letter to a Reddit community called No Burp. Thousands of people, all describing the same mysterious inability, all describing the same pain. And suddenly, what felt isolating became shared. Across the world, patients were reporting identical symptoms: severe bloating, chest and throat pressure, inability to release gas upward, and in many cases, intense anxiety around vomiting. Some even described bizarre internal sensations, gurgling, popping, and pressure shifts in the chest and neck. The condition now has an actual name, as I said. Retrograde, you can read that sign there. I'm not going to try to say that one again. It involves a muscle at the top of the esophagus, the cricopharyngeus, that fails to relax when it should. In simple terms, the gate that allows burping stays shut. For most of medical history, this condition went unrecognized. Patients were often told nothing was wrong or that symptoms were all in their head. But that began to change when an ENT specialist, Dr. Robert Bastian, started connecting the dots. After evaluating multiple patients with identical complaints, he identified a pattern, and crucially, he identified a treatment. Botox, yes, commonly known for its cosmetic use, can also temporarily relax the cricopharyngeal muscle. In clinical settings, a small injection is delivered to the upper esophageal muscle. The goal is not cosmetic, it's functional. To open the gate, to allow trapped air to escape. For many patients, something remarkable happens. Within days, small burps begin, then stronger ones, and eventually, normal function can return. For people who have never burped in their entire lives, this can feel like a reset, a correction of something they didn't even know could be fixed. In one documented case, a patient described the first burp as small, strange, almost unbelievable. Days later, the symptom cycle that had defined their life, bloating, pressure, discomfort, began to fade. Food no longer caused panic. Social situations no longer required planning around pain. But the journey isn't always instant. Some patients required retraining, learning how to coordinate the muscles and trigger burping naturally. It can involve posture changes, breathing techniques, and gradual adaptation. Most of us guys learned how to burp when we were young at the playgrounds, huh? And while Botox is often temporary in other uses, here something different can happen. In many cases, the body learns, and the ability remains even after the medication wears off. Researchers now believe this condition may have affected far more people than previously recognized, simply overlooked due to its unusual nature. After all, it's not a symptom most patients volunteer in a routine medical visit, and it's not one most clinicians were trained to ask about. But awareness is growing. Online communities have helped bring patients together. Specialists are increasingly recognizing the pattern, and treatments are expanding globally. So, for those living with R-CPD, the impact goes beyond digestion. It affects confidence, social life, and daily discomfort. Some patients reported years of avoiding restaurants, carbonated drinks, or even social gatherings just to manage symptoms. And yet for many, the breakthrough comes from something deceivingly simple. Single muscle, small injection, and return of a basic human reflex, the ability to burp. It's a reminder that even in modern medicine, some of the most disruptive conditions aren't dramatic or visible. They're hidden in plain sight inside everybody's bodily functions that we assume everyone shares, until someone doesn't. And when that changes, so does everything else. I'm Vic Senese. Thanks for watching. In tomorrow's episode, we take a closer look at emerging evidence that BCG-exposed bladder cancer patients may account for a large share of recurrences, progression events, and subsequent surgical interventions. We'll break down why failures occur after BCG therapy, what patterns are being seen in recurrence and progression, and how this is reshaping surgical decision-making, and what clinicians should be watching for next.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines. UroNurse News.